iAfrica Media, the biggest media platform for all things eye care on the African continent. I'm your host, Obi Malope, an optometrist based here in South Africa, the motherland. And today, we are privileged and fortunate to be hanging out with a former colleague of mine, a former student, a former classmate, none other than Tharien Schoeman. How are you today, Tharien?
Hi, Obi. I'm good. Well, I'm well, thanks. And yourself?
I'm very well, very well. We have not seen each other, I think, over a decade.
Yeah, since varsity.
You look very young. People, if I have to tell people when you graduated, they'll be very, very shocked that you were one of the dinosaurs in the industry.
Thanks, but yeah, I'll take that as a compliment.
It definitely is. Definitely
young
is.
for a dinosaur.
Can you believe it's literally over what 10 years?
Yeah, more than 10. When 2009. Yeah.
My goodness. Yeah, that's a long time ago, eh? How are you finding the industry when you look back at how the industry was? 2010 when you entered into the market space versus now in 2023. What is the biggest thing that stands out for you that's different now compared to back then?
Well, if personally in my own life, I think I've always enjoyed eye care, but I think I've found my passion now the last couple of years, and I've started enjoying it much more than I did when I got into it. I feel for me at this point in my career, it's a calling. It's about health. It's about eye care. When I got into eye care 10 years ago, it was more about, getting a job, working, just putting in the hours and living for after hours. Now I enjoy eye care. It's a passion. For me, it's about the patients.
What changed? What happened along your journey that influenced where you are at right now? And how long did that take you before getting to that spot, to that space where you can say, it's my passion, it's what I love doing. I look forward to waking up in the morning and fulfilling my purpose. What changed along your eye care journey from back then to now?
Yeah, I think I'm one of the few people that can actually say I enjoy my work and I can't wait to go to work. I think personally for myself, I actually had this conversation a couple of weeks ago with someone and said, I can't believe it took me so many years to figure out what my role is in eye care. And I think what changed for me is finding my niche, which is the nonprofit work that I do, and approaching eye care not as just a job, the 8 to 5 thing, but the patient as a whole, and helping them with their specific need, finding the gap in the market and filling that gap, and helping the patients that have nowhere else to go.
Wow, that is absolutely incredible. And I know we're already like in the thick of things with questions and the discussions, but just to track back a little bit, how did your eye care journey begin? In the sense that, was optometry something that you always wanted or something that you fell into by chance? Like, how did your eye care journey begin?
Now we're going back way more years. So I always knew that I wanted to work with people and something in healthcare. Wasn't really sure what exactly I wanted to do. And I applied for optometry. I got accepted. I wanted to still actually apply for veterinary sciences, but when I got into optometry, when I got accepted, I just thought, let me give it a go. And yeah, I am. As everyone heard, we studied together. I graduated 2009 at the University of the Free State. And then I'm not sure if you even know, I did a postgraduate diploma in sports vision at UJ in 2010. So yeah.
I didn't know.
I went on to study some more, as if I didn't have enough after the Free State. But that's my journey. Started working in Springbok in Namaqualand in the Northern Cape of South Africa, and I'm still here.
Wow. For the people that don't know anything about the Northern Cape, because we've got audiences from Ghana, Tunisia, Egypt, Nigeria, Kenya, I mean, the entire continent gets to see this conversation that we are having.
Yeah.
How big of a city? Is it a city? Is it a town? How many optometrists are in the area? Is there a hospital, an eye care hospital there? Can you give us a bit of a background in terms of the eye care setup in Namaqualand at the current moment?
Okay, so I would describe it more of a town, not a city. We don't have a private health hospital, like a private hospital. We only have our one provincial, the public hospital. There's no eye care services in the public sector in Springbok in the Northern Cape. Our closest public health sector or public health eye facility, sorry, is in Kimberley. And that's about 800 kilometers from us. So that's the closest. So what optometrists in town, we are about, I think, 4 or 5 private practices. So there's a lot of private facilities, but not public health facilities for eye care, specifically in our area.
Now, navigating then between if I think about the area that you are mentioning, the patient profile will not necessarily belong to a high-end incoming market. It will perhaps be low-incoming to middle-incoming earning individuals or patient profiles. With you then navigating between your non-profit work as well as your private work, how did that happen? Like, were you exposed to non-profit work through someone who was already doing it? Or was it something where you looked at there was a need within the community that you were providing private care services for, and then you went in that route where you ended up discovering your passion? What came first, if you don't mind me putting it that way?
Yeah, no, that's fine. I love talking about this. So not at all. I did not meet anyone that worked in non-profit work in eye care at all. I just saw the need specifically in our area. Like I mentioned, I've been in private practice since 2010, and it's just been a constant thing of patients coming in with specific pathology, main focus cataracts. Let's stick to what we're doing. So specifically cataracts, and you can't do anything for them. It's not as you know, as most people that would watch know, cataracts aren't exactly an emergency. So the patient can just continue on and go blind with those cataracts. So yeah, seeing a lot of patients with cataracts coming in, they're blind, I can't do anything. I just have to put them on a waiting list for surgery and send them away. So it got frustrating. It felt like, I can't do my work. I'm an optometrist. I'm supposed to help them see better, but here's all these patients and I can't do anything for them. So I think it was in end of 2021. I just felt that, something has to be done. It can't go on like this. Even though, I'm seeing patients, a lot of them you can't do much for. So beginning of 2022, I just decided to dive headfirst into the non-profit world and start the non-profit doing cataract surgery for these patients. This has definitely opened up the door for more patients coming to see me with a wide variety of pathology. Obviously, everyone thinks they've got a cataract, but it turns out that it's not necessarily a cataract. So it's opened the doors to a lot more patients coming into my door for help.
Wow, that is absolutely amazing. What can be done, though, from a patient education point of view by us as professionals, as primary eye care givers? Because a lot of the times, especially in low-incoming areas, sometimes, like you say, patients tend to come when it's too late. And when they do come when it's too late, it's either the vision problems that we detect are as a result of normal refractive errors or pathology that has influenced the visual system at the end of the day. So now, what can we then do as optometrists in terms of patient education at an earlier stage, such that patients then are well informed throughout the years, long before the problem becomes how it presents in your particular practice?
Yeah, well, you mentioned the word patient education. That is one of the cornerstones that I feel so important in our profession. I feel a lot of optometrists are just chasing the bottom line, just chasing profits, which I understand we are still business people. We still do have to focus on the business aspect of a practice, but patient education is so important. If you educate your patient about the need for sunglasses to protect for cataracts, for diabetes, a wide variety of things, and explaining that to them, and also showing that you care for their eyes and their eye care and their overall health, they would come back to you. Explaining that follow-ups are important, your 2-year follow-ups. It's not just about having you back into the practice so we can dispense spectacles and make money off you. It's about your health, the overall health of your eyes. One of the thoughts that I had while preparing for this was my approach is also multidisciplinary. It's not, we're not an island. We're not just eye care workers. We have to look at this patient has uncontrolled diabetes. I can't just refract him, give him glasses, and send him on his way. We have to educate them on their sugar levels and refer to the necessary people that can help them get that under control, so you don't sit with someone with diabetic retinopathy that you can't help.
Sure. You make me think of back in optometry school. I don't know about you, but I don't necessarily personally, I hope I don't get in trouble with this, but I don't think that there was enough integration that took place between ourselves and other health disciplines. I feel like we had that awareness of other health problems that patients go through, but in terms of linking it together, a lot of us, we only got to do that when we got into practice and dealing with the necessary condition or problem that you are faced with at that particular time, before realizing that, you know what, I can't work in isolation. I need to work with this healthcare professional. I need to work with that particular professional. Do you think that we can do more of that? And if so, what would you advise for the optometry schools to then start doing in helping us navigate in that direction?
Yeah, no, I definitely agree. I think that was one of the things that you have to learn when you're in practice, which I personally would have felt, I think, more comfortable being more educated on that while still in optometry school. I definitely think there should be integration between the different professions, and also professional relationships after varsity with your different healthcare workers in the area that you work in. What the optometry school should do, if I just think of where we were studying, we were on our own in a separate hospital away from the rest of the students. They were in a different hospital. I would prefer, or I think it would be better having all the students together in one setting where they can refer more easily and work together with the patient. Something like the Vula app, for example, that is fantastic. I don't know if you work with that, but they not at all. An amazing app.
Please go into detail about what the Vula app is.
Yeah, so the Vula app connects different professions, and also specifically focusing now on optometrists with ophthalmologists. So specifically more for us in the rural areas. So I can on the app I can chat to an ophthalmologist in Kimberley about my patient, send through photos, all the data, whatever is going on with the patient's case, and they can advise me through the app and give me advice for the patient, or even treat the patient like that without the patient having to travel 800 kilometers. And there's different options of referring to other disciplinaries as well. So it's an integrated approach that the app is taking. Why can't that also be applied in optometry school? Let's work together with our general practitioners, our dietitians, even, psychologists. Patients come, and I'm sure you have seen patients come unpack all their problems in your chair, and we are not necessarily equipped to handle them with their mental health. So yeah, definitely let's have all of the different healthcare students under one roof and work together, have some classes together, and educate about a multidisciplinary approach.
Wow, I love that response, because I'm thinking of certain parts of the African continent where they've got a similar setup to what you have in Namaqualand, whereby you've got optometrists and ophthalmologists not necessarily close to one another. One is literally 500 kilometers further from the other one, and the solution that you are providing could actually be applicable to different parts of the African continent. So I absolutely love that, because that will fast track the processes that are involved in making sure that the patient comes first. The patient is well taken care of, not just for their eyes, but the whole health care need would be taken care of, which is very, very important. A question that I would have for you is, how did you go about equipping yourself in then operating or functioning within the nonprofit organization? Because it obviously comes with new knowledge, new skills, new processes and systems that you have to acquaint yourself with in making sure that you can be able to do the work that you kind of do. What are some of the challenges that you have gone through in setting up a nonprofit platform or organization through eyecare? What are some of the lessons that you have learned throughout the process and the skills that you have gained throughout the process? If you don't mind going into detail about that.
Just remind me if I missed some of the things you asked.
So it's two things. One is how did you have to equip yourself with getting ready to do the kind of work that you had to do? Two will then be the challenges that you went through in the process, and then three would then be the lessons that you learned throughout the process. And then the fourth one, which I will touch base on later, would be some of the testimonies that has come through as a result of the work that you are doing.
Okay, so firstly, how I equip myself to do this, I would definitely say I think I just jumped into it without knowing a lot, but I have to say though that I got involved with our business chamber in town in the Namaqualand region. We have a business chamber, so I was part of the team doing that, which is also a non-profit, even though it's more business orientated non-profit. I learned a lot of non-profit, how they work, the processes to get them registered, and getting your section 18A, those kinds of things. So I learned a lot working with that team. Other than that, I honestly just decided one day, let me do it, and I'll learn along the way, which is also a great thing. It forces you to actually put in the work and put in the hours and figure it out as you go along. So I wouldn't necessarily say that I had a couple of mentors along the way that helped me, that was always there to answer some questions. So definitely jumped in head first without knowing a lot, but I had a little bit of a background with a business chamber that was a non-profit. Some of the challenges, definitely just getting funding. I think that's the main thing, funding for that. But I've learned to swallow my pride. It's for my patients, and if it's for them, I don't mind going, asking for help and for funding and reaching out to people. I'm a bit more of an introverted person. Don't know if you remember from varsity.
I don't believe you. There's nothing introverted about you. You like saying that you're introverted, but then once you're comfortable with what you're doing or your settings.
Yeah, but see that I'm an introverted extrovert. so I've had to learn a lot just to be out of my comfort zone and just get out there and share and ask help. And I think that was one of the biggest challenges, getting funding, and also just putting myself out there, because it's my dream, and even though it's for the patients, it's still my dream, and if people don't buy into that dream, it also won't be a success. So I think that was one of the big challenges. What I've learned through the whole process is that honestly, money doesn't buy happiness. There is nothing more joyous than seeing a patient that has not had any hope of going for cataract surgery, being blind in both eyes. This past week, I was at a cataract outreach. I think I mentioned that to you earlier. Yes. And one of the patients was a 28-year-old girl that was blind in both eyes. And seeing the joy on her face, getting the eye patch removed after surgery, she was crying tears of joy. There is literally no money in the world that can make up for the happiness of seeing that patient's face when they can see for the first time. So I think that was one of the lessons that I learned, that put in the hard work and don't necessarily expect something back, but doing it for the love and for the passion of optometry and of eye care.
Sure. You know, you make me realize that I think sometimes we get into the rat race and we actually forget why we became optometrists in the first place. We forget what resonated with us when it came to eye care and eye health. And along the way, we commit to all these financial needs and demands, and that optometry then, or the work that we do, is defined by the material things that we want to achieve, instead of prioritizing the very vision, the purpose of why we got into eye care in the first place, and all the other things will then follow suit in relation to that. Do you have enough support from the industry?
Definitely from the optometrists in town. They all support me. And I mean, they all just so happy that I started this nonprofit. Ophthalmologists, I have a great ophthalmologist, Dr. John O'Pons, that helps me with helps us with the surgeries. If it wasn't for him, I honestly don't know what we would have done. I think I would love more support from ophthalmologists. I know everyone's got their businesses, and at the end of the day, we are still running businesses. But like you mentioned, let's not forget why we are in the industry. And if there are any, ophthalmologists that would be willing to donate their time and their skills, we would really appreciate that so much. Without the ophthalmologists, we can't do what we're trying to do.
Wow. I've seen some of the work that you have been doing, because one thing that has also stood out for me, and why we wanted to get you onto the platform, was you are very active as well with regards social media. You're very active with regards connecting with or sharing the work that you do on public platforms, whether it be TV, radio. You have literally put yourself out there in making sure that nothing gets in the way of the work that you do, because at the end of the day, you want patients' lives to change, and the quickest way we can do that is through changing how they see the world, And so, what was your approach to utilizing those type of communication platforms? Because what I've found in the industry, sometimes we look at what another person is doing and we just try and copy and paste it, and then it doesn't work or benefit us in the manner that we had envisioned. So in your case, with you then being on LinkedIn and literally sharing your journey, sharing your story, how has that benefited the work that you do?
Firstly, even though you don't think I'm an introvert, putting myself out there on social media and being on I've been on TV a couple of times and on the radio, out of my comfort zone totally. But I have to say that I have an amazing team supporting me. One of my directors is a professional videographer. She's responsible for all our amazing social media marketing and the videos and the photos and everything that you see. So our approach has just been shamelessly sharing. We're just sharing it all over and spreading awareness. I have to say, though, that has been one of the biggest tools for us getting funding. From social media, people have the episode of Dankie Lottoland that I was on. They found us on social media. We didn't reach out to them. They found us through one of the posts that we shared and contacted us. And I mean, we got a lot of funding from them, and just other funders that have found us through either radio or social media have approached us. So I have a really good team supporting me and helping me with that. And one of our main points was putting it out there, spreading the word and creating awareness for this big problem that we're trying to handle one bite at a time.
Wow, I think what I'm loving the most about this conversation is how your passion is tangible. I mean, your passion for patient care, for patients, it's so tangible. I'm actually getting goosebumps just thinking about those people's lives that you are changing through the work that you do. Your relentlessness, it's truly inspirational. And I know that people that are going to be watching this or that are watching this are going to find that spark that used to exist in them being ignited again. You have no idea how we're having a simple conversation, but you are sharing such powerful, inspirational pearls of wisdom. And I believe that people are going to be inspired by just hearing you speak, because this basic optometry that we keep doing just to survive does not cut it. It's not going to change anyone's life. So thank you so much, Tharien. I wish you nothing but the best. I'm fully confident that we're going to see more of you through the work that you're going to be doing. And we as Africa Media would love to support you in whichever capacity, just so that we can even share your journey and the work that you do, because I'm fully confident that people in other parts of the continent are going to be inspired and also then be challenged to go and start similar work in their respective countries. What would you advise a despondent third-year optometry student who is close to finishing but is frustrated, or a final year student who's thinking to themselves, I've got about 6 months to go and I don't know what my role is going to be? Where would you advise, or what would you advise them to do leading up to the time that they have to graduate? How should they expose themselves? How should they gain the necessary skills or knowledge with such a limited time left in helping them be prepared to enter the market space? Because I think it's more difficult now than it was in 2009, which we also made it was different for us when we entered the market space compared to people that finished in 1985 or 1995, So what would you advise that young optometry student or ophthalmology student who's close to finishing and doesn't know where in optometry they're going to find themselves in?
Well, if you have a year or even 6 months left, I would definitely suggest just putting in the hard work. You have lecturers, professors now giving you that knowledge. Soak up as much as you possibly can. And what I would suggest, looking for work where you're going to be busy, where you're going to be in a practice where you're not going to just sell sunglasses. I mean, that's great. We still need sun protection, but get into a practice where you're going to be learning a lot, seeing a lot of different patients, not just, the normal refractions. Getting a wide scope. That is why I actually came to Namaqualand, because I heard, there's a lot of patients, you see a lot of pathology, and that's how you learn. Getting into a practice where you have maybe a mentor, or finding a mentor, even if you are alone in a practice, finding a mentor in the industry that's been working for a couple of years, and ask them to help you. I would love to do that for students, and I'm sure there's a lot of other optometrists that have been in the industry, or even ophthalmologists, that would love to share what they've learned and just pass on the knowledge. So I think the one main thing is getting a mentor that can help you, and getting into a practice where you're going to learn a lot. And then finding your passion, finding your niche. It doesn't necessarily have to be nonprofit work, but finding what is going to set you apart from the next person, that's going to lead people into your door.
Wow, I love that. Where can people connect with you on social media?
We have a Facebook page if they're looking specifically for the nonprofit, Caring4Sight Namaqualand. So we're on Facebook, Instagram, LinkedIn, and then we are busy with our website currently. I actually got the test page yesterday. So we are working on our website, which will be launching soon.
Wow. Tharien, thank you very much for being such an inspiration. I'm so inspired by you. You have no idea. I wish you nothing but the best. On behalf of Africa Media, we're looking forward to just see more of the wonderful work and supporting you as best as we can. Everyone,
Thank you so
make
much.
sure that you subscribe to the Africa Media YouTube channel. Make sure that if you're not yet following us on Instagram, LinkedIn, or Facebook, do so right now. And yeah, make a difference. Don't ever treat any patient as by the way. You know, one thing that I personally got from this conversation with Tharien is that every single person's vision matters. Every person's eye health matters. And so never treat a patient as a by the way, irrespective of how much they're going to be spending in your practice, irrespective of where they come from, irrespective of their eye care needs. Never treat them as by the way, and you will start enjoying optometry again. Until the next episode, everyone, take good care.